Vertical Health Services is rewriting the playbook for long-term care leadership. In long-term care, reputation determines survival. Vertical Health Services learned that truth early. Before the company grew into its current scale, it acquired a facility with a difficult regulatory history. The building's previous owner had received poor survey results, and regulators assumed the new owners were connected to the old operator. By the time Vertical Health Services proved otherwise, officials had already started the closure process. That experience was expensive but formative. It left one lasting message: if you do not tell your story, someone else will, and they may tell it wrong. Since then, Vertical Health Services has treated transparency and proactive communication as core business principles, not optional strategies. A culture built on speed and accountability. Vertical Health Services operates skilled nursing and long-term care facilities in Washington, Missouri, and Tennessee. Its leadership model prioritizes agility, accountability, and empowerment at the local level. Unlike many large healthcare organizations burdened by complicated ownership structures, Vertical Health Services maintains a small, focused ownership group. That design eliminates bureaucratic bottlenecks and enables faster decision-making. Healthcare today rewards speed. The constant churn of staffing shortages, reimbursement changes, and new regulatory demands leaves little time for slow approvals. Vertical Health Services' leaders are trusted to act quickly and make informed decisions on the ground. The result is a system that can adapt to the realities of each market and community. The company's philosophy is simple: the industry evolves, and effective operators evolve with it. Balancing risk and growth in healthcare, risk is often defined in financial or compliance terms. Vertical Health Services takes a broader view. The company practices what it calls a balanced approach to risk. Leadership occasionally greenlights projects or ideas even when success is uncertain. If that initiative develops leadership skills, resilience, or judgment, the effort is considered worthwhile, even if the outcome is not immediately profitable. For Vertical Health Services, the greater risk is hesitation. Saying no too quickly can stifle innovation and prevent the organization from learning. In long-term care, doing nothing can cost more than taking a calculated risk. The company's approach encourages action, reflection, and continuous improvement. Hiring for grit, not just credentials. When building its leadership teams, Vertical Health Services looks beyond impressive resumes. It prioritizes grit and consistency, attributes that sustain leaders through the daily challenges of long-term care. This environment is demanding. It requires balancing regulatory expectations, family concerns, and the human realities of aging and end-of-life care. True leadership means showing up every day, staying steady under pressure, and doing the right thing repeatedly. Vertical Health Services values leaders who can learn from mistakes and demonstrate perseverance. That consistency builds trust with residents, staff, and families, creating the stability that strong facilities depend on. Managing regulation and avoiding burnout. Long-term care is the second most regulated industry in the United States. Compliance requirements have expanded significantly since COVID-19, even as staffing has grown tighter and burnout more common. The central challenge today is balancing paperwork with patient care. Documentation is essential, but it does not replace time spent at the bedside. Vertical Health Services addresses this through targeted technology use, automating administrative tasks where possible while protecting the human side of care. This is not a broad digital transformation campaign. It is a practical effort to reduce friction and return time to caregivers. The company also recognizes the emotional weight carried by healthcare workers and promotes an environment where that pressure is acknowledged, not ignored. Growth through partnership. A recent milestone for Vertical Health Services involved acquiring the physical properties of 3 Washington facilities. The process initially met resistance from the prior owner. Instead of forcing a rigid solution, Vertical Health Services chose collaboration. Partnering with U.S. Healthcare Group allowed the transaction to move forward in a way that served all sides. The structure was designed for mutual benefit rather than uniform control. That flexibility has since turned into a long-term partnership. For Vertical Health Services, growth is not just about adding buildings, it is about creating stable ownership models that support operational control and improve resident outcomes. Owning the physical plant gives an operator greater control over capital improvements, long-term planning, and strategic direction. The Washington deal is a strong example of how vertical health services blends creativity and discipline to achieve sustainable growth. A practical view of sales and service. Many healthcare organizations avoid talking about sales. Vertical health services tackles it head-on. In skilled nursing, families often make admission decisions quickly during moments of crisis. Responsiveness can determine where a loved one receives care. For vertical health services, every unanswered call or delayed email is a missed opportunity to serve. The company treats sales as an extension of operational excellence. Being transparent and responsive is seen as a form of care, not just customer service. Admissions teams are trained to provide clear answers fast and to maintain communication throughout the decision process. Vertical health services also stays visible in the communities it serves, sharing measurable data on clinical improvements and operational success. By telling its story directly, the company builds trust and reinforces credibility, a vital currency in long-term care. Crisis is a constant for most long-term care providers. Crisis management feels like an occasional event. For vertical health services, it is a daily discipline. Each day brings challenges involving residents' health, family expectations, staffing, or regulation. Vertical health services trains its teams to respond with flexibility, compassion, and accountability. This proactive stance grew from earlier hard lessons, including the regulatory misunderstanding that once forced a facility's closure. Today, silence is considered a risk factor. Leaders communicate early and clearly to prevent misinformation from taking hold. Transparency is built into every layer of operations. Evolving the portfolio with purpose. Vertical health services' growth philosophy is measured and methodical. The company invests heavily in improving existing operations while pursuing strategic acquisitions that complement its culture and service model. Internal improvement remains a constant focus. Clinical outcomes, resident satisfaction, and staff experience are all tracked and refined. Acquisitions are considered only when they enhance the organization's long-term stability and mission. This balance, expansion paired with discipline, reflects a maturing leadership team. Growth is meaningful only when it strengthens care quality and operational integrity. Reputation as a strategic asset. The lesson that shaped vertical health services' early days still guides its strategy. Reputation must be built deliberately and defended constantly. In long-term care, reputation affects everything: referrals, compliance scrutiny, staffing, and partnership opportunities. A strong reputation earns trust with regulators and communities. A weak one invites assumptions that can be costly to correct. Vertical health services actively controls its narrative. It publishes data on performance, communicates openly with stakeholders, and stays visible in the marketplace. Investors receive a clear operational snapshot of portfolio health and measurable performance indicators. By owning its story, the company strengthens credibility and reinforces confidence among partners, families, and employees alike. What sets vertical health services apart? The long-term care industry is crowded. Many operators claim commitment to quality and service, but few back those claims with structural flexibility and consistent communication. Vertical health services stands out for several reasons. It empowers leaders to make fast, well-informed decisions. It encourages measured risk that develops leadership strength. It builds growth on partnership rather than control. It makes responsiveness a core operational value. It treats communication as an essential business function, not an afterthought. Most of all, vertical health services understands the cost of silence. In an environment as regulated and scrutinized as long-term care, credibility cannot be assumed, it must be earned daily. Vertical health services has built its business on that principle, rewriting what effective leadership looks like in a space defined by both disruption and necessity.